Thanks, I am Janine Ontiapco, and with me are my groupmates Aina de Guzman, Clea Garcia, and Gracia Velasquez. Today we will be talking about our research on vaginoplasty and phalloplasty, two gender-affirming surgeries that play a significant role in transgender healthcare. First, let's talk about gender reassignment surgery. This surgery helps transgender individuals align their physical traits with their gender identity, reducing dysphoria and improving well-being. Vaginoplasty constructs vagina for transgender women, while phalloplasty creates a penis for transgender men, often in multiple stages. Let's further discuss vaginoplasty. It is a gender-affirming procedure that reconstructs or constructs vagina. It involves removing the penis and testicles to create a neo-vagina, helping to alleviate gender dysphoria and improving quality of life. So the main goal is to create a vagina with depth and appearance similar to a biologically developed one using penile tissue. The vaginoplasty procedure consists of the following key steps. So first, removal of the penis and testicles, then the creation of a vaginal cavity between the urethra and the rectum, then the preservation of sensitive skin for the vaginal lining and the clitoris, then use of scrotal skin to deepen the vaginal canal, then refashioning penile, scrotal, and groin skin to create labia majora and minora. And then lastly, the relocation of the urethral opening to a female position. With this, several surgical techniques can be used. So the first one is penile inversion vaginoplasty, which uses penile skin to create the neovagina, preserving sensation and offering a natural appearance. The second one is the peritoneal pull-through technique, which uses peritoneal lining, which provides lubrication and greater vaginal depth. And lastly, the vulvoplasty focuses on external female genitalia without creating a vaginal canal. Moving on, these are the medical considerations before, during, and after a vaginoplasty. So before surgery, patients undergo physical exams and preoperative testing to assess their fitness for surgery. Contradictions include active smoking and uncontrolled diabetes. During surgery, risks include infection, bleeding, vaginal stenosis, or narrowing of the vaginal canal, and rectal injury. After surgery, follow-up care is important for monitoring healing, including dilation therapy to maintain vaginal depth. And patients may experience normal post-operative symptoms such as brownish, yellowish vaginal discharge for the first few weeks. With that, the psychological state of the patient should also be considered when undergoing vaginoplasty. So before the surgery, patients should be evaluated for surgery candidacy, ensuring that they are mentally prepared for the procedure. Also, stability of psychiatric conditions such as depression and ADHD will be assessed. During the surgery, psychological readiness is important in relieving gender dysphoria. So patients receive support to manage surgical anxiety and post-surgical adjustment. So after the surgery, vaginoplasty often enhances confidence and body satisfaction. So ongoing psychological support can help individuals adjust emotionally after surgery. Lastly, social factors such as support systems, daily routines, and self-care ability should be considered when undergoing vaginoplasty. So during surgery, social considerations include managing stigma, navigating relationship changes, workplace policies, and accessing healthcare. Emotional adjustment is supported by securing strong support networks and managing expectations. After surgery, post-operative care may include monitoring for complications such as diversion colitis, and patients benefit from social support and community resources to navigate their transition smoothly.
What are the potential risks, benefits, and outcomes of vaginoplasty? Benefits. Vaginoplasty significantly alleviates gender dysmorphia, leading to improved mental health, self-esteem, and overall well-being. It enhances physical comfort and sexual function with advanced techniques such as sigmoid colon, peritoneal vaginoplasty, providing natural lubrication for more comfortable post-surgical experience. Risk. As with any major surgery, vaginoplasty carries potential risks. Common complications include infection, delayed healing, and vaginal stenosis, which can be prevented through consistent dilation therapy. Some individuals experience loss of sensation, and in a rare case, excessive bleeding or fistula formation may occur. Outcomes: success rate exceed 90%, with many transgender women reporting high satisfaction in both functional and aesthetic outcomes. However, long-term success relies on proper post-operative care, adherence to dilation schedule, and ongoing medical follow-ups. Emotional well-being and strong support system are also crucial factors in recovery and overall satisfaction. Discuss the experiences of individuals who have undergone vaginoplasty, including personal narratives or case studies. Psychological and emotional impact. Many transgender women feel immense relief and happiness post-surgery, gaining confidence and a sense of completeness. However, some experience post-surgical depression or anxiety, highlighting the need for psychological support. Social and societal reactions. Despite undergoing surgery, some transgender women still face discrimination. This undergoes the importance of awareness and acceptance of gender-affirming surgeries. The role of social support. Social support significantly improve post-surgical experiences. Those with strong support networks reports better recovery and mental health outcomes. Vaginoplasty is deeply personal and transformative journey. While it brings psychological and physical benefits, challenges remain. Support, education, and acceptance are essential in making this experience empowering.
Paloplasty is a surgery that creates a penis, often done in stages. It's not just for looks, it helps with both physical function and emotional well-being. Some people also get other procedures like making the urethra longer to pee standing up. There are different ways to do paloplasty, and each has its pros and cons. One common method is called radial forearm free flap. Doctors get skin and tissues from the arm to create the penis that can give good sensation but with noticeable scar on your arm. Another method is anterolateral thigh or ALT, which uses skin from the thigh and scar is less visible, but not much sensation. There are others way too, and each choice depends on what the person wants most. Before surgery, people often take testosterone for a year, and doctors check that they are healthy enough for the procedure. After surgery, recovery can take time. Some people feel relief from gender dysphoria, but others may experience anxiety or depression. Therapy can help with the emotional support during this time. Paloplasty can bring relief from gender dysphoria, but it can also cause emotional challenges. Some people feel anxious or depressed, especially if there are complications. Therapy and counseling can help manage expectations and provide support during recovery. Socially, individuals may need to talk to family, friends, or employers about their transition. There are also legal changes to consider, like updating ID documents. Having a strong support system, including the friends, family, and LGBTQ+ groups, can make these transitions easier.
Phalloplasty is a significant procedure that comes with both risks and rewards. On one hand, it offers life-changing benefits. It plays a crucial role in addressing physical and emotional challenges, and results provide a natural-looking penis capable of functioning sexually. It alleviates gender dysphoria by improving gender alignment, which in turn increases self-esteem, mental health, and overall life satisfaction. It can also enhance sexual function and comfort, and for many, the ability to urinate while standing is a major improvement in day-to-day life. However, like any other major surgery, there are risks. Complications for phalloplasty may include flap loss, urethral strictures or fistulas, wound dehiscence, pelvic bleeding or pain, injury to the bladder or rectum, loss of sensation, prolonged need for surgical drainage, and the potential necessity for revision surgeries. A systematic review analyzed the outcomes of gender-affirming phalloplasty, assessing effectiveness, associated complications, and patient-reported satisfaction. In a study of 1,731 patients who underwent phalloplasty, the overall complication rate was high. There was a 76.5% of complications, with urethral complications being particularly prevalent across all reconstructive subgroups, including urethral fistulas 34.1% and strictures 25.4%. Among the 57.6% of patients for whom postoperative functional outcomes were reported, the majority retained tactile sensation 93.9% and the ability to boil while standing 92.2%. Many individuals report feeling increased self-esteem, a greater sense of authenticity, improved quality of life, and increased social confidence post-surgery. However, with that said, challenges remain. Societal reactions and discrimination can still be obstacles, and some individuals experience mental health struggles post-surgery. This is why support systems matter. Those with strong social networks, whether it's family, friends, or the LGBTQ+ community, tend to have better emotional recovery. Therapy and counseling are also key factors in long-term satisfaction, helping individuals navigate both the physical and the emotional aspects of the process. Ultimately, phalloplasty is a deeply personal decision. While there are risks, the benefits can be transformative, providing individuals with not only physical changes but also a sense of alignment, confidence, and well-being.
The impact of these surgeries on mental well-being, including potential improvement or challenges in mental health post-surgery. Gender reassignment surgery, including vaginoplasty, phalloplasty, has profound impact on the mental and physical well-being of transgender individuals. One of the most significant benefits is the reduction of gender dysmorphia, as aligning one's physical body with their gender identity helps alleviate distress. Many individuals also experience improved self-confidence and body image, leading to better social interactions and overall emotional well-being. Studies have shown that those who undergo gender-affirming procedure often report increased life satisfaction and psychological stability. However, according to Janine, despite these benefits, some individuals face mental health challenges after surgery. Post-surgical depression can arise if the results do not fully meet expectation, while body image concern relates to scar, swelling, or healing can affect self-perception. Financial and social stressor, including the high cost of surgery and potential discrimination, may also contribute to the anxiety. Additionally, the adjustment period, both physical and emotionally, can be challenging, requiring time for individuals to fully adapt to their new bodies and navigate societal perception. According to Clea, proper psychological preparation and support before and after surgery are crucial in ensuring a smoother transition. Pre-surgical psychological assessment help individuals set realistic expectations, while counseling and support group provide emotional reassurance. Post-surgical mental health support, including therapy, can assist in managing body image concern in social adjustment. With the right resource and strong support system, individuals are more likely to experience long-term satisfaction and improve well-being. And lastly, according to Gresha, beyond mental health and physical recovery process also present challenges. Surgical complications such as infection, bleeding, and issues with the healing or potential risk, requiring careful post-operative care. Pain and discomfort are common in initial recovery phase, and some individuals may need additional procedure or hormone therapy adjustment. Despite these challenges, many transgender individuals find that the long-term benefit of gender-affirming surgery outweigh the difficulties, ensuring accessible healthcare and mental health resources remain essential in supporting their journey towards self-acceptance and overall well-being. This is all for our presentation. Here are our resources for reference. I am Inez Esti Guzman, and together with my groupmate, Janine Onquiapco, Clea Garcia, and Gresha Velasquez, thank you for listening.